You might be surprised to learn that female circumcision of minors used to be performed in hospitals in the United States of America. Female circumcision was legal to perform in the U.S. before 1996, only 14 years ago, and was covered by Blue Cross Shield, the largest medical insurance company in the U.S., until 1977. In other words, female circumcision was not only legal, but was insured and often performed right here in the U.S., even after most of you were born. Now, I'm not talking about Muslims here. I'm talking about middle and upper class, Caucasian, mostly Christian, American families getting their little girls circumcised, often by the request of their pediatricians. It all started in the Victorian era, not long after some doctors of the era began promoting male circumcision. Many of them began to justify female circumcision using the same rationales: to deter masturbation, treat nervousness or hysteria, epilepsy, neurasthenia, and for general health. Claims that female circumcision could protect against disease and prevent smegma buildup were fairly common in the medical literature on through the 1960s. Even the well-known physician and inventor of the cornflake, Dr. Harvey Kellogg, jumped on the bandwagon to promote female circumcision. In his book, Plain Facts for Young and Old, Embracing the Natural History of Hygiene and Organic Life, Kellogg wrote, "The object, female circumcision, is the same as that of circumcision in the male. In females, speaking of female masturbation, an application of pure carbolic acid to the clitoris is an excellent means of allaying the abnormal excitement." While not as common in the UK, the London obstetrician Isaac Baker Brown performed many clitorectomies on women and young girls in the late 19th century. There are no reports of medicalized female circumcision in the UK after Brown. However, not the same can be said for America. While British doctors now frowned upon Brown's ideas, American doctors asked, what now will be the chance for recovery for the poor epileptic female with a clitoris? I'm now going to further go through some papers published in respectable medical journals to give you a better perspective of some highly respected views on female circumcision in America, starting with Robert Morris's paper entitled, "Is Evolution Trying to Do Away with the Clitoris?" published in the journal American Association of OBGYNs in 1892. Preputial adhesions in women are similar in character to those which occur less frequently in men, and the resulting disturbances are alike in both sexes, but greater in degree in women because of the more impressionable nervous system of that sex.
The clitoris is to disappear as civilization advances.
The irritation of preputial adhesions early attacks the attention of the child to that part, which is frequently rubbed to give relief, until the habit often becomes a fixed one, innocently on her part, as the girl grows older and neurasthenia results. After collecting enough cases for statistical purposes, I dropped the subject, as it is naturally repelling to one of the opposite sex. But the proper persons must at once take up this work of looking after adherent prepuces in young girls. The fast-growing girl with preputial adhesions may become languid enough to sag into scoliosis, and no amount of orthopedic treatment will stop the scoliosis, which is but a symptom in her case. The young asthmatic, the girl whose uterus is antiflexed, the child who is listless and fretful and fanciful as to her food, the patient with enuresis or dysuria and with menstrual irregularities, the hysteric, the patient with epileptoid convulsions, the patient with nervous dyspepsia or spasmodic stricture of the esophagus, or non-inflammatory paralysis of the legs. All of these must be examined by the diagnostician for preputial adhesions. I do not wish to be understood as underrating the importance of any other well-known cause for the same symptoms, errors of refraction perhaps standing first in causal relation for many of them, but would simply state that preputial adhesions are the prime factor in a sufficient proportion of these cases to at least make it necessary for us to eliminate that factor wherever it is found. Chronic local irritation may be stopped, and some unresponsive wives find that the clitoris was at fault. The proper time for the separation of preputial adhesions
is when the baby is first born,
and as a matter of routine practice. Baker Brown, I believe, was very near to the subject of preputial adhesions when he published his work on the curability of various forms of insanity, epilepsy, catalepsy, and hysteria. One of my patients who suffered from epileptoid seizures with several attacks weekly, stimulating grand mal, is reported by the family physician as having had no attacks for a year since circumcision was performed on her. Very many neurasthenic girls made prompt and striking improvement as a result of the same treatment. In a word, I may say that separation of preputial adhesions in girls accomplishes just what it does in boys. I now advocate the removal of the prepuce instead of simply separating it from the glands. In July of 1898, in the Journal of Orificial Surgery, Scott McFarland, in his paper Circumcision of Girls, wrote, "Every few moments she would grind her teeth, of which she had her full complement, squint her eyes, straighten out and utter a cry, unlike the familiar one of an epileptic. Parents had taken her to every doctor in town, as well as before the Missouri State Medical Society, where after careful examination they pronounced her about hopeless, but advised to do nothing and that at maturity she would probably improve. The parents were not satisfied, as that was the advice given to them with an older child, and it died at 2 1/2, with symptoms identical to this one.
I had the child stripped,
And immediately saw the body was covered with hair, as completely as if she were a fully developed woman instead of a 2-year-old child. Knowing such a growth of hair came at puberty, and puberty meant an activity of the sexual system,
I examined the clitoris.
or where it ought to have been, but it was so neatly sealed in by a hypertrophied hood that I could not find a trace of it. We immediately administered chloroform and began to unearth
The most completely bound down clitoris I had ever seen.
the hood
Where it was amputated,
was just 1/2 inch in thickness. From that day, the child began to improve, and now, 15 months later, with no medicine whatsoever, save possibly zinc phosphate and passiflora, she can walk, talk some, sleeps and eats well, eyes nearly straight, but little grinding of her teeth. Is still very nervous, but infinitely improved, and according to her mother's statement of May 19th, she is getting better, stronger in every way, improving every day. Some of the blind doctors have opened their eyes and are anxious to know what has brought about such a change.
only the circumcision of a girl,
And as many little girls
would be benefited by such treatment
as boys,
and I for one have circumcised as many girls as boys, and always with happy results.
in June of 1915, published in the American Journal of Clinical Medicine, Benjamin E. Dawson, a doctor from Kansas City, Missouri, wrote, "Circumcision in the Female, Its Necessity and How to Perform It." Disastrous reflexes and nervous disturbances,
Often caused by the clitoris, boldly amputated the offending organ with
excellent results in some cases. A large number of physicians fail to realize the importance of the proper condition of the foreskin in the male, that in order to avoid the dangers of
convulsions, eczema, paralysis, constipation, tuberculosis, locomotor ataxia, rheumatism, idiocy, insanity, lust,
and all its consequences, the prepuce must be completely loosened. If too long,
amputated,
if too tight,
split open.
a much larger number of physicians are seemingly ignorant of the fact that females have an organ anatomically corresponding to the penis in the male. Each produces a cheesy substance which hardens under an adherent prepuce. The same category of diseases, having had their origin in nerve waste caused by pathological foreskin in the male, may be duplicated in the female from practically the same cause, and in addition other diseases peculiar to females.
Chorea, chlorosis, hysteria,
And various nervous disturbances nearly always have their origin in the faulty condition of the hood of the clitoris. Reflexes travel along the line of least resistance. Irritation in the sexual organs, therefore, may reach the mental or moral faculties, resulting in
imbecility, sexual perversion, or moral degeneracy.
many neurosis and even psychosis have their origin in pathological conditions of the hood of the clitoris. The girls have been sadly neglected. Therefore, I make a plea on their behalf. I feel an impulse to cry out against the shameful neglect of the clitoris and hood. Some 2 months ago, a child 2.5 years old was brought to me from Ottawa, Kansas. It presented a bad case of marasmus, malnutrition, and anemia. There was little development, the lower limbs hanging almost as useless as strings. The child made no effort at vocal articulation.
The clitoris was completely snowed under,
With an adherent hood, the adhesions were broken up,
and circumcision performed.
the mother was instructed to retract the hood each day in order to prevent adhesions reforming. This was neglected to some extent. The child was brought back since I began the article, while the hood had adhered to the clitoris again, yet the improvement in the baby's condition is very gratifying. Her muscles have filled out, her thighs enlarged. She can bear weight on the limbs and use them in taking a few steps. She speaks plainly several words. A slight pinkish tint has flushed the previously chalky white skin, and there is a marvelous improvement in her general appearance. Under a general anesthetic, the adhesions were again broken up. This child will recover. Other cases relieved by circumcision. A few months ago, a little baby, 3 or 4 weeks old, had colic each time after taking the bottle. Examination revealed
a hooded clitoris.
The indicated work promptly and permanently cured her. A baby girl, 2.5 years of age, had been troubled all her life with furunculosis, anuria, and malnutrition. She had been treated by different doctors for different diseases, but with no benefit. The clitoris was completely buried beneath the adherent hood. In a few hours after circumcision, the red, angry boils on her face had perceptibly paled. In 36 hours, they were dried up. Her kidneys began to act normally, and she was transformed from a cross, peevish, discontented child into a state of perpetual sunshine. A girl 16 years of age, well-developed but neurotic, had been troubled with nocturnal enuresis from babyhood. Circumcision, with some other indicated orificial work, at once stopped this embarrassing condition. Another, Sarah C., 7 years old, a bright, beautiful child, well-nourished.
A masturbator.
She was brought to me to have this evil habit corrected. Examination showed she needed circumcision to relieve constant external irritation, which was exciting the sexual passion. A widow of 46 came into my office, heavily veiled, and requested a private interview. She handed me a copy of the Journal of Orificial Surgery with a request that I read page 83. On this page was an article giving the symptoms of nymphomania caused by the hooded clitoris. With deep mortification, she said she had been bound in chains by this demon since she was a little girl, and that I was the first person to whom she had ever mentioned it. She requested permission to remain veiled, while I circumcised her under local anesthesia. She afterward expressed her
heartfelt gratitude for her release.
A girl of 10, following an injury to the hip, presented all the characteristic symptoms of hip joint disease: tenderness, heat, swelling, pain in the knee with soreness in the hip joint in pressing upon the knee, also from pressing against the trochanter, slight elongation of the limb with a tendency to throw the knee across the other limb. This case was presented to a doctor who was an orificialist as well as a general surgeon. He found the clitoris in a very irritable condition and its hood firmly adherent. Following the needed attention to the clitoris, a few weeks in bed, without even using extension upon the limb, restored the limb to a perfectly normal state. In May 1918, in the Texas State Journal of Medicine, Bella C. Eskridge wrote a paper called "Why Not Circumcise the Girl as Well as the Boy?" I need not remind you that the male and female genital organs are developed from one and the same origin, the Wolffian buddies, and that no sex distinction can be determined until the 7th week of fetal life. Our anatomies describe the clitoris as being developed from the genital eminence, which in the male becomes the penis, the clitoris being the erectile structure, which is the morphologic homologue of the penis. The glans clitoris, like the glans penis, is covered by a very sensitive membrane that the genital fold bounds laterally. The genital furrow on the undersurface of the genital ridge becomes in the female the labia minora. The upper margin unites to form the prepuce in the female, and the covering of the scrotum in the male. In the retroglandular sulcus of both the clitoris and the penis are found numerous small glands that secrete a sebaceous material. This is found as frequently under the adherent prepuce of the girl as under the adherent prepuce of the boy. Is it reasonable to believe that an irritation produced by an adherent prepuce that can reach the mental or moral faculties of the boy, resulting in physical discomfort or
sexual perversion
and mental or
moral degeneracy,
would not have the same effect upon the girl? At this time, circumcision is considered by the profession to be a beneficial procedure for the welfare of the man-child, ignoring the fact that the girl-child has an organ anatomically corresponding to that of the boy. This is strange when we reflect that the girl
may have all the diseases
originating in nerve irritation caused by an adherent prepuce that a boy can have, with some added that is peculiar to the female. Over half a century ago, the reflex nervous disturbance caused by irritation of the adherent prepuce of the female was recognized, and the
removal of the clitoris with some of the surrounding structures advised.
a few going so far as to trace and dissect out a large part of the nerve supply. In the last few years, attention has been directed again to the clitoris as cause of reflex irritation.
Of the large number of girls whom I have circumcised,
and the boys circumcised by other members of staff, there is as much improvement in the girls as in the boys. The superintendent says that the girls show an even greater improvement than the boys. Some of them are quite changed in character. The improvement in health and general appearance of the girls is surprising.
I have examined the genitalia of over 250 girls in this home.
Less than a dozen were normal. And by this, I mean a clitoris with a prepuce short enough to expose the glans clitoris with no smegma in evidence. The glans should be free from adhesions. When the prepuce is stretched laterally, these girls are wholesome, normal girls of better mental balance.
We have both girls and boys who have masturbated.
I am sure masturbation in a child before puberty is not due to an internal emotion, but to an external irritation or outside influences. There were 2 baby girls in the home 1 year
who were masturbators.
One rubbed the vulva almost continually. She could not remain quiet even while taking her food, but would turn over on her abdomen and keep in motion while nursing her bottle. At the request of Dr. N.N. Allen,
I circumcised her and removed a piece of smegma as large as a grain of wheat.
She soon began to improve and discontinued the habit, and while she is an abnormal child, there is a general improvement since I circumcised her 18 months ago. The other baby received the same attention and was relieved. The superintendent reported to me that one of the caretakers had found a girl of
9 years with a large wash rag packed tightly in the vagina and in the act of masturbation.
1 year after circumcision, she has not been found masturbating. She is far below normal, yet she is more biddable and easier to handle than before the operation.
Circumcision will relieve one of the greatest causes of masturbation.
The operation of circumcision of the girl is a very simple surgical procedure. I hope you will not infer from this paper that I believe or recommend circumcision of the female as a cure-all, but I do insist that it will give as good results to the girl as to the boy, and that the female genital organs should receive as careful attention at birth as those of the male child. In 1958, in the journal General Practitioner, C.F. McDonald from Milwaukee, Wisconsin, wrote the article Circumcision of the Female. In it, he writes, "If the male needs circumcision for cleanliness and hygiene, why not the female?"
I have operated on perhaps 40 patients who needed this attention.
A youngster was suspected of having epilepsy at about 2 years of age. She was brought to my office with the mother and was left alone while I examined the mother. I noticed the child masturbating while rubbing back and forth in a sitting position. She finally toppled over in hyperventilation. The disorder disappeared with a simple expedient of female circumcision and the cleansing away of irritants. Female circumcision was done. Smegmaliths were cleansed away. Very thankful patients were the reward. For the first time in their lives, sex ambition became normally satisfied.
Most of the patients have been children, 2 to 10 years old.
The mothers complained about the irritability of the children, their unusual habits,
and sometimes their bedwetting.
When examination revealed the presence of a hidden or partially hidden clitoris, it was a simple procedure for the doctor to effect return to normality. The same reasons that apply for the circumcision of males are generally valid when considered for the female. The following year, in 1959, also published in General Practitioner, W.G. Rathman wrote a paper called Female Circumcision, Indications, and a New Technique. In his paper, he writes, "Redundancy or phimosis of the female prepuce can prevent proper enjoyment of sexual relations, yet some modern physicians overlook indications for circumcision. If the patient is quite adipose, a circumcision could be indicated, although she has less anatomic defect. Obstruction by the adjacent tissues adds to her problem. This operation may help cure her adiposity by relieving psychosomatic factors." What percentage of favorable results can be expected when the previous indications are followed? To determine this percentage, a questionnaire was sent to women who I had circumcised within the past 15 years. 112 questionnaires were completed and returned, 85 to 90% to show satisfactory improvement.